So hello everyone, I am Dr. Leena Yadav and today here we are to discuss how does age affect the female fertility and how does it increase or decrease your chances of conceiving through IVF. How does our age impact female fertility and its success rates when we go through IVF? One of the most common questions women ask us in the OPD is, how does age affect my chances of getting pregnant naturally or if I want to conceive through IVF? Yes, it's a very important question. In this video, let's understand how fertility changes for a woman with age and how does it affect the rate of success in IVF and what are the options available at different ages of life when you come to a doctor in OPD for a fertility treatment. Now let's understand how does fertility and age both go hand in hand. Every woman is born with a fixed number of eggs, around 1 to 2 million at birth. By puberty, this number drops to just few lakhs and only a few hundreds of these eggs are released during the actual reproductive years of your life. After 28 to 30 years of age, this number, quantity and quality both decline gradually. After 35, this decline is still faster and by 40, the decline is sharp. And by 40, not only the numbers, even the quality of these eggs decline sharply. This makes chances of natural conception decreased if you want to try naturally or if you want to try through IVF. And not only the chances of natural conception decrease, but there are increased chances of miscarriage and chromosomal abnormalities if you attempt pregnancy in the late 40s of your life. So both in IVF or naturally, a woman's age plays a major role in success of IVF or attaining a pregnancy. This is all what we have understood by now. Now, on an average, women who are less than 30 have about a 50 to 60% success rate per cycle if they go through IVF. Between 30 to 35 years of age, this success rate falls down to 40 to 50%. After 35, it still decreases further and the success rate is only about 30 to 35% if you plan a pregnancy naturally or undergo IVF. And by 40 years of age and in the late 40s, this drops to almost 20%. Also depending on the individual health of a woman, because mostly at the age of 40, you have other comorbid health conditions which are also there. So the overall woman's reproductive health along with these associated comorbid health conditions affect the actual success rate of IVF after 40 and brings it down to 10 to 20%. Now the good news for all of us in this fertility science is that we have options available in the reproductive management for all the women of all the age groups. And this is a real big news. It's just that you have to avail those options. For women under 30 or between 25 to 30, lifestyle management, lifestyle modification is a very important factor. These days I'm seeing women conceive very late. You know why? Because in their early ages, they have got multiple partners. They are prone for smoking. They are prone for alcohol. They are prone for junk food. No. If you have a proper lifestyle management, if you take care of your reproductive health in the early years of your life, and if later on you come to know that you have to plan an IVF through any of the particular reasons, your success rates definitely increase if you had a good lifestyle in the early ages of your life. So between 25 to 30 or women under 30 who want to undergo through IVF, or even if you don't want to undergo through IVF, you plan that you have a future, you want to make your career, you can go for egg freezing or you can stop smoking, caffeine, alcohol. All these are not good. And you can go for options like egg freezing if you don't have a partner. And if you have a partner, you can really avail IVF if you think that yes, now we have a diagnosis and natural conception is not possible. So lifestyle management is a very important factor and it gives excellent results. For women between 35 to 40, we have advanced techniques in IVF. Techniques like ICSI, blastocyst culture, techniques like PGT, pre-genetic testing, where we test the embryos if they have any kind of aneuploidy, and these techniques can be used when you plan your IVF cycle between the ages of 35 to 40. If you are above 40 and if the doctor says that you have to go for IVF, you can consider the options of donor eggs, because mostly after 40 the egg reserve declines. The quantity and quality, as I discussed earlier, both matter a lot. So we can take the option of donor egg, or we can also go for embryo adoption adoption if there are issues with the male also. So in embryo adoption, we can take a donor egg, we can take a donor sperm, we can make a good embryo out of that, and then we can put it inside your uterus to give you a healthy pregnancy. Thank you so much. Hoping to see you soon, and all the best for your reproductive outcomes.